Hello, my name is M. Tilking, and I'm presenting on behalf of the Behavioral Supports Ontario Provincial Coordinating Office, which is based at the North Bay Regional Health Centre. Today I will be introducing a new, comprehensive, and practical clinical resource called the Clues, Causes, and Care to Consider for Responsive Behaviors. This resource is designed to help care teams better understand and support responsive behaviors or personal expressions often associated with dementia, complex mental health, substance use, and other neurological conditions. It encourages the users to view these expressions as meaningful communication of unmet needs. Clues, Causes, and Care to Consider for Responsive Behaviors was developed through interprofessional collaboration, with input from clinical educators, allied health professionals, point-of-care staff, and healthcare leadership. It is grounded both in clinical expertise and current evidence from literature. Importantly, it draws on two well-known tools. The first is the Behavioral Supports Ontario Dementia Observation System, also known as the BSODOS, for which the included behaviors are pulled from the observed behavior legend. The second tool is the PIECES framework, which encourages holistic assessment through a lens of physical, intellectual, emotional capabilities, environmental, and social factors. This structure helps to ensure the resource is both evidence-informed and practical for real-world use, using models of care that teams are already familiar with. Clues, Causes, and Care to Consider for Responsive Behaviors is a 200-plus page resource which will be made publicly available in the fall. Each section identifies possible contributing factors for those behaviors and offers corresponding preventative, non-pharmacological approaches and strategies. These approaches are grounded in person-centered care, meaningful engagement, and cultural safety, with the goal of preventing behaviors before they occur and identifying the unmet need that the behavior is communicating. To guide care providers when preventative approaches are unsuccessful, there is also a section for each behavior on how to respond in the moment. Again, based on clinical expertise and current evidence. This portion offers evidence-informed strategies for when behaviors occur despite preventative efforts. It encourages staff to respond through a lens of harm reduction, identifying unmet needs, physical and psychological safety, and tailored care based on personhood. There is also a dedicated section for supporting individuals during personal care, recognizing that this is often when distress and personal expressions arise. These sections reinforce the importance of individualized care, emotional well-being, and maintaining safety and dignity, even in moments that may feel overwhelming both to the person with dementia and their care provider. Clues, Causes, and Care to Consider for Responsive Behaviors can be a guide to comprehensive behavioral assessment and to inform care planning. It is designed not to just be cut and paste into a care plan, but rather to be a clinical conversation starter, helping teams reflect on the why a behavior may be occurring and how to best respond. By consulting this tool, care teams can expand their understanding of contributing factors, explore practical non-pharmacological interventions, and strengthen team-based decision-making. Ultimately, it supports care teams in shifting from reactive responses to proactive, person-centered approaches that acknowledge that responsive behaviors are expressions of unmet needs. In summary, Clues, Causes, and Care to Consider for Responsive Behaviors is an evidence-informed, interprofessionally developed resource that enhances how we understand and support people experiencing responsive behaviors. Once released, we will seek user feedback to inform future revisions of the tool, ensuring it remains clinically valuable and grounded in best practices. Once released, you'll be able to find it on our website through scanning the QR code. Thank you.